its case. But when it comes to us, oh my God, have you started having sex? That is the first question that. But me thinking about that in the first place makes me, oh, I don't want to go there. Let me just maybe reach out to a pharmacist, maybe go to a chemist and just seek these services. Since those people are not going to be asking me these questions, it's so able to the fact that young girls they find it difficult to say they want to buy menstrual pad. When you want to buy menstrual pad, you say, maybe when people are there, you just tend to use codes or you let them go. Then you say, I want to buy menstrual pad. I used to be like that. I used to buy some nylon, wrap it around the throat and start sewing because I believe it's something I have to keep secret. I have to nobody should know about it because it makes me dirty, and that is what I've gotten to know. That is what I've been told that this is how this thing is. But getting acquainted with sexual and reproductive health and right education, I knew about this, and I know I was like, no, I can't do this anymore. Whenever I want to buy a pad, I say it on the top of my voice. So I want to buy this particular. And that woman was like, aren't you ashamed? I said, aren't you ashamed of being who I am? I can give birth to you. If your mom was actually, would she have given birth to you? And I was like, oh my God, that's true. So if we take this thing to what people can relate to it, they will actually understand what I'm talking about.
Yeah. So this actually brought one experience to mind, and I think a lot of us were actually shy at some point to get sanitary pads. But now, I can walk it to any store, look for the brand I want. I will carry it. If you like, look. If you like, don't. It concerns you. Because last, you get sister for us with the drum.
Exactly.
You get mama with the drum. And because your mama with the drum, that's why they blow you. So why should I be ashamed of what I didn't have control over? Because I didn't choose to come to earth to be a woman. I just saw myself as being a woman. And if this is what it comes with, I will carry it gently on my head with all pride. And make it, because at the end of the day, you're also, some other young girls are looking at you while buying that, and they're able to take that up from you. Alright, this is 27 minutes after 12, right here on Women Radio WFM 91.7. And of course, we're having an amazing conversations as regards sexual reproductive health rights this afternoon on The Big Question. And I have two amazing women with me, and we have been discussing this, especially as it regards to accessing these services in marginalized communities, in rural communities, because whether we like it or not, we come from a village, and when you go to that village, some of the things they don't know, and because you know these things, they have helped you to make better decisions for your life. Meanwhile, they that are there, they don't know any better, and even if they know, maybe not exactly what it is, they just know it as something passive, but they wouldn't really know it. So let's come back to, the technology aspect of this. Now, with Nigeria's improved digital connectivity, how can mobile health technologies, telemedicine, and digital platforms be integrated into the existing SRHR framework to reach adolescents and young people in remote and underserved areas more effectively? Let's not forget that even where we are, we still deal with a lot of network problems. And then it's not even everybody that is even open to telemedicine. It's not everybody that is open to digital platforms. And we know how maybe it can be a little bit expensive to own a mobile device. Taking to access all of these tools, or what do you call it right now? All of this I've forgotten the name, but just to have all of the applications in your phone. So let's even imagine people in the rural areas now with all of this. How are they able to access this? Because if I cannot go and face a nurse, or if I cannot go to hospital to go and tell a nurse, please, I've been having unprotected, sex, and I would want to protect myself better. Guide me through. What are my options? If I cannot go and meet a nurse, eye to eye, and sit down and tell her because I'm not good enough, I should be able to go to my phone now, enter any telemedicine application or digital platform, ask these questions, and I will get the answers I need without even having to face anybody. But they over there can't actually do that. So, what do we do, or where can we go from here?
Okay, thank you. Honestly, when we talk about adolescent and young persons in rural area, there are a lot of challenges. Data is expensive. The fact that there's just this very wide margin considering rural and urbanization in Nigeria. When you go to your village, you know the kind of work you do, rely on salary, go to farm, amount of money they have access to, and all of that. Like they can't even afford data properly. It shows that even if you have all these telemedicine, or you can actually access health services online, it shows the disparity. Now, let's see how we can bring this in. Although we can rule out that there are some people in these rural areas that also have access to, we can try to push this to those people and find a way to also try to inculcate this or help other young people who don't have access to internet through SMS services. There's one SMS service that when you send the code, they respond and all of that. All these chat bots that you can do through SMS.
Yeah.
So promoting that SMS service, even if you have a touchlight phone, you can be able to access these health services. You can type, maybe when you respond, hello, I want to seek health services. They can respond with, okay, if you want to seek HIV services, you can
press one.
All those kind of things. Everybody that has a phone can actually have access to all those things. Like something when you want to buy data, is as seamless as that. So in rural area, that will really help. That SMS engagement kind of setting for like telemedicine innovation will really help in rural communities. Then the e-pharmacy too. A lot of people don't want to walk into stores to go and buy or maybe pre-exposure prophylaxis drugs that prevent them from having HIV. If you have somewhere you can order it online and people get this information, that is why it is very important that we engage young people. They are the ones that pass this information around to other people. Like if a young person gets pregnant, before they try to consult the pastor or another person, she has told her friends. Now, if her friends don't know the right information, they will mislead her. So it is very important that we try as much as possible to promote this telemedicine innovation through maybe SMS in rural areas now, even though we have the other facilities available, and we also expose them to it. So that is why it is very important that youth engagement is very, very important. Let's have dialogue. We are the ones that are facing these things, and we know the ways through which we feel like, okay, this would be okay. Because I used to say something, in Africa, we really don't need CCTV cameras, because if I'm entering into, maybe there is somewhere where they provide sexual and reproductive health services, and Yabola, our next compound neighbor, sees me. She would tell my mom information will get. Yes. That is why it's very important to embrace technology. Whereby it is discreet, it is safe. There's this privacy. I can actually access information that I want to access without being discriminated against by anybody seeing me or walking into any store. So it's really a long way in trying to break this down.
All right. I like the fact where you mentioned even use a touchlight phone, because it's not everybody around areas that can actually afford, the big phones that we get to see all over. And that's actually way easier, through text messages. Is it this thing you want to access, press 1? Is it also, medical care you want to access, press also? And that will actually go a long way. All right. Thank you very much, Simi. I want to
Yes, I just want to chip in something.
Yeah.
Okay. It's a very, very good and impactful initiative to say that we can use the SMS method. But the first thing I want to say is, how do they get to know about this initiative? How do they know that it is in existence? So how do they get to know it? So since they are in the rural communities, we can leverage on radio stations, where they listen to radio. Oh, you know that this particular initiative has started? You can do this on your phone, or even on your small mobile phone. You can do this, you can do that. So when the information gets to them, they don't know how to take the initiative, because without the knowledge, without the awareness, they cannot take this initiative, and that's it. So,
I definitely agree with you, because the information has to go down first of all before they even know what to do. So yes, I definitely agree with you. All right, so now let's look at the involvement of young Nigerians in SRHR policy development and implementation, which is definitely essential for creating youth-centered programs. Now, what mechanism do you think can be introduced to ensure their active participation in policy process? How can Nigerian youth be empowered to advocate for their sexual and reproductive rights? Because now basically the way should I know the picture. So we can't go about making policies and we are not involved. Because after making the policies, they will just look and they know. Nothing. If you bring it down to them, they will tell you that this is not what we want, or this is not how we want it to look like. So that is work done zero. So at the end of the day, how do we get to have them actively participate in these policies, especially as regards to their sexual reproductive health rights?
Okay. Let me quickly chip this in. When it comes to adolescent and young people, there's something that we usually say is like a slogan, there is nothing for us without us. Okay, so excuse me, you said you are making a policy for us. We were not there in the first initial stage. The deliberation, the consultation. There was no young person, it's just old men, old women making consultations on our behalf. You know, so there is no way that policy is going to like be impactful or achieve its goal. So what I would say is maybe there should be National Youth Committee where it's focused on sexual and reproductive health and rights, where young people can come together and deliberate on policies before it is being passed into reading and all that. You know, when you consult these young people, it also makes us know that okay, we are recognized. Yes, we are recognized, and our contributions actually count. Because if we are not being included in these processes, then we believe that they are just doing it for themselves. That is why when some parents are telling their kids that I don't want you to do this, but you don't tell us the reason why you don't want us to do that thing. That means you are just doing it based on your own initiative. You are not telling us, oh, this is the reason why I don't want you to do this. It is because it's going to birth this. But because we don't know, we don't have that information, so we believe that it is just for them. And then when we react against that, they call us rebellious, we are doing this, we are going against their rules and that. But when we are engaged in these processes, then it makes it more, it makes more sense. It makes more sense. And at the end, there's not going to be any loophole of, oh, there are no young persons involved in this, or this is not going to be possible. But when it's throughout the process, when people are involved, then that means everything is going to be key.
Okay, thank you very much. So, I would also like to repeat something. I think one of the ways to decentralize this, yes, what we are saying, young people should get involved, but in situations whereby there are opportunities for young people to come on board, majorly we want in urban areas have the opportunities, the same information to get involved. How do we decentralize this to ensure that people in rural areas also have access to get involved in this decision making, this policy dialogue? We should kind of have this youth advisory council whereby maybe we have clubs from secondary school, whereby we have representatives in each school that talks about sexual and reproductive health, whereby we can empower them with the necessary information and knowledge. Maybe they just talk about it on the assembly, maybe like 10 minutes, maybe on Wednesday on their social gathering, whereby they can also revert. Maybe there's an opportunity for them to write, maybe to the state council, to the local government council, to the community area council, so that everybody at all stages can be involved in this process of making decisions and everybody can contribute so that we can really know what is involved. Then another thing is we should also sponsor youth-led research because the way my friend will get information from me is not the same way somebody like my mom will get information from me. Because there's a lot of things that comes to my mind where maybe somebody who's in their 50s, 60s is trying to engage me on sexual considering in the Nigerian system. It is a mixture of morality and the community now. So we are trying to face a lot of things, and there's also religion there. So when I'm looking at somebody who is modestly dressed, I know that this mommy, pastor, Mrs. Ashes, so are you sexually active? I don't understand what you're saying because I know that they are about to judge me. So in this kind of setting, we should encourage youth research-based innovations. We should empower them with the resources that are necessary because without the youth, nothing can be done. Getting the AYP. So it is very important that we also prioritize this.
Okay. I definitely hear you. We need to actually prioritize this because at the end of the day, this is for them. So if you don't involve them, for me, it's just look as if people should just keep talking there. We'll still do what we want to do because we don't understand what you're doing in the first place. So if you don't bring us in, then I'm sorry. We can just keep making policies and then we'll say we're having lots of policies, but there's no implementation. So when it comes to implementation, who did you involve in the first place? And you want to implement something on me. So yes, it definitely has to start from somewhere, and it's by, having all of them involved, at least a group that will represent the whole lot, involved. Alright, so this is about 20 minutes to 1 right here on Women Radio WFM 91.7, and I have amazing women with me in the studio, and today we are looking at a very important topic on the big question. We are looking at innovating for equity, bridging gaps in SRHR access for adolescents and young people, and that's sexual and reproductive health rights. Alright, for adolescents and young people, that's AYPs. Alright, and with me in the studio this afternoon is Simi Lundua Awe. She is a lawyer and youth development practitioner with over with about 8 years of professional experience. All right, and I also have Anu Luapo. She's a public health student at the University of People, and she is a passionate and an unapologetic feminist with over 6 years of experience in sexual and reproductive health. All right, so of course, we still have we will still have a lot of things to actually cover. We'll see how we can definitely try to manage our time. Well, my name is Rose Yusuf Kaiser, and this is a Women Radio. So now we've talked about how to get, youth and young people involved in policy making, especially as regards to sexual and reproductive rights. Now let's look at how the Nigerian CSOs, CBOs, NGOs, and all of those private organizations that could actually help to improve the outcome of SRH services. So how do we bring, all of these bodies together? How do we bring them to collaborate? Because at the end of the day, we want everybody's hands to be on deck in terms of strengthening, or rather in terms of serving the AYPs better, in terms of helping them make better decisions or informed decisions, particularly in areas with limited government presence, because that's one of the important things about CSO, CBOs, and NGOs. They get to places that government cannot necessarily reach, but most times with the help of the government, they get there. So, how do we bring all of these bodies together?
Okay, thank you very much. I would say that in bridging all those gaps we are talking about, you cannot work in silos, because at the end of the day, nobody's going on their word of so that kind of thing. So it is very important. The government will say we are pumping money into the states. Civil society organization are getting grants and they are pumping it towards the state. But the thing is, we are not really seeing the result, because the government is also nailing the same, or they are also eating the same nail that civil society organization is trying to nail. So it's just like putting so much effort and resources to address the same problem, but just one fraction of it. Now, what can we do to ensure that the government and civil society organization and corporate body get to the grassroots to really make sure that we are doing something really significant? Is by having a formalized partnership with government bodies. Okay, the government is saying, okay, we are facing Ogun State this month. Then the civil society organization will know that, okay, if it's Southwest project you are doing, then we should go and face on those things. It's not like everybody keeps going to everybody keeps going to everybody keeps going to and leaving the rest of the community. So this formalized partnership will really help us to break this gap so that the government can have somebody to hold accountable. Then another thing we can also do is to have joint funding initiatives whereby the government can help the private sectors to ensure that we are also making the same, like we are reaching the same goal, but there is a way that the government can make the private sector accountable. There is this thing about, they will say it's government money, and people in government, sometimes you cannot hold them accountable because it has eaten deep into our system, and that is how things are. It is government money. So nobody's going to come and make you accountable. But when the government is giving the money to a private sector, that's when they know that they have the best time to evaluate and monitor this project to make sure that they're actually using it for the best thing they can use it for. So this partnership, partnership will really help us to be able to know where we are going, and the places we have not reached. It will also help us to even collect data. Let's have this conversation. Let's know where we are going, where we have reached, and the places we are going to reach. So the government can support these corporate organizations, society organizations, empower them. They make sure that they also monitor what they are doing. It will really help us to move fast.
All right, thank you, Simi. Let's hear you on this one.
Okay, just want to chip in something. According to what she said about joint collaboration, working together. So I think just like what she said, to avoid duplicate efforts, if the government has a plan of reaching maybe like 6 states in this particular month, maybe they were able to reach 3, then you collaborate with NGOs, CBOs, and all the CSOs. Oh, we have reached this particular state. You don't want me to go back to that state because it was like duplicate efforts. Everybody is channeling everything, their initiatives, their resources into a particular location. So when also there is a need for memorandum within government and all these CSOs begin to sign an agreement to ensure, okay, this is what we are going to do regarding this. And at the end of this is when we are going to track this progress. Because we doing initiatives that are not sustainable, there's no way we track. Oh, we said we empowered 5,000 women last year. Have we gone back to check the lives of these 5,000 women? Are their lives different? Have things changed for them? Like what we really did, the initiatives, are they really impactful in their lives? Because it is very easy for us to put it in paper and say, yes, the government empowered 5,000 women in Koshofe. Yes, take pictures. It's flying in the newspaper. It's everywhere. Yes, but how can we be confident about what we have done and say, oh, let's go back to what we did? Is it really still working? Is it really still effective? I've known about several government initiatives that were established, but now you can't even talk about them anymore because they are no more functioning, they are no more in existence. But when we started them, everybody was so happy about it. Oh, we are starting this, this is going to be impactful. But go back to it. They're no longer they're no longer effective, they're no longer in existence. So we need to ensure that there is sustainability in every program that we're carrying out with government, with NGOs, with CSOs, with CBOs, especially CBOs, because most of CBOs, which are community-based organizations, they are mostly underrated. People don't really rate them that, and they are the ones that work closely with the grassroots. These people that we really want to talk about. But when it comes to all this political establishment, then we remember the grassroots, that these are the people that we need to go to get their, their votes, to get their agreement. So I think we really have a long way to go when it comes to government and CSO
collaborations. Yes, of course. When we want to look at it outside SRHR, if you look at a lot of issues, then you definitely understand that there's a long way to go. And their efforts cannot be overemphasized, because as much as we need the government, we need them.
Yes.
Because they get to reach places and touch bases with places that the government, maybe in the next 3 years or 4 years, the government will think of going there. But they must have actually, during elections, they get to go there and make all sort of promises. And after then, NEPA don't have lights. So let's try to see how we can manage our time so that we're able to cover a lot of things here. Now let's look at steps that can be taken to improve the implementation and quality of comprehensive sexual education in Nigerian schools and communities. Because earlier, Simi mentioned how we can get representatives from each school to come together, bring up some of these policies that will help them, and then take it further from there. So now, how do we get to improve the implementation of the quality of comprehensive sexual education in Nigerian schools and communities? Because if they're not well educated, for them to know that I have rights when it comes to sexual health, and if I don't know, then even if you come to choose me to be part of the the people that will talk, I wouldn't even know what to say, because as far as I'm concerned, my mother must not hear that I'm in this kind of group. So I don't want to get involved. So, but if they have the education, their minds are open and they're able to go further to ask questions. So how do we involve this into schools and communities?
Okay, thank you very much. To inculcate sexuality, enlightenment, and education into our curriculum, it is very important for us to do a curriculum reform that inculcates this form of lesson into our educational system. And this will not be easy, because some private schools have tried on their own volition to enlighten these young people, to teach them information about their private body and all of that. But the parents are always very resentful, and which is very understandable. Now, the thing is, you are telling us that you want to start teaching our children sex education and all of that. There are a lot of parents who feel like maybe a male teacher is taking my female daughter. This might be a way of this teacher getting involved. We have a lot of pedophiles and everything.
Of course, you can never be too careful.
We need to also have this community engagement, that we are trying as much as possible what you are putting into the curriculum. It's not like we are teaching a child in kindergarten reproduction. It is very inappropriate for the age. So we need to also have this community engagement with the parents, that okay, at different levels, these are the kind of information we want to pass along to these children to help them. Then we also need to train the teachers. The teachers need to know which one to do and which one not to do. Because a lot of people don't even understand the whole essence of sex education, or what it entails, or how you can inculcate this into the education system and all of that. So aside curriculum reform, we need to do teachers training, we need to do community engagement. We also need to have youth-friendly teaching change methods. We also need to teach these teachers how to tell them, oh, maybe in primary one, you have to tell them, this is my private part. You cannot touch my private part. Oh, anybody that tells me that I should not tell my mom is my enemy. This kind of thing. The children will not forget. You can even formulate a song that will help them remember and tell their parents if these things are happening. Then one thing that is very, very important, evaluation and monitoring. Because before the whole thing gets out of hand and they will say, oh, it's a society organization. That's encouraging this thing now. Now the teacher is sleeping with the students in class, teaching them that is sex education. It is very important that we evaluate, okay, how far this is going, what we are teaching them, how this is impactful, and also monitor the things that are being taught to the students, which is very, very important. So this will really help us to inculcate it into our system and make sure that we are actually giving them the education that is age appropriate.
Definitely. All right, do you want to add something?
Yeah, just quick.
Go ahead.
Okay. So I really appreciate your points where you talked about, using like a form of song for this. Yeah, I think I recently heard that in private schools now they are teaching them songs about if you touch my body, songs like there are places that if you touch, then they tend to let you know that you are going wrong. So I think that is really, really important. And there's something that Vision Initiative does. There's this program we do in secondary schools, junior schools, where we teach them about their rights. But the entry we do is we want to teach these girls about their bodies, their rights, how to say no consent and all that, bodily autonomy. So but when it comes to the teaching, we let them know this is what we are actually talking about. And we do not, just like what she said, we engage the parents. We let them understand that your children are going to undertake this particular education so that you don't get your daughter doesn't get home and start saying, oh, that is what it's because of what they taught you and now so you are doing this to me, you are doing that to me. Because we have to ensure that for you to pass your information to these children, if you are not involving their parents, you are making a very huge mistake. You have to let them know. And also the teachers are going to be involved in that education. They must be trained. So you can't assume that this person has this knowledge. It's a lie. They don't have the knowledge. You have to train them. You have to engage them. And there's something about anonymous reporting. We call it a Pandora box that only the girls can access. Only the students can access it. They put questions about their bodies, maybe whatever has happened to them. And we get a lot of discoveries that we will think that this could never happen to somebody in this particular class. Like maybe molestation by their father, parents, uncles, that they can't even tell their teachers, they can't tell their mom. There was even one that said she has gone to her mom, and the mom was like, my husband can never do that. How can you dismiss your daughter over what happened and you're saying your husband can never do that? So you imagine that kind of cases. That is when we come in and we take up these questions and we treat it and we take it to the necessary, like Lagos DSVA, we work with them and we treat these issues. Because if we are talking about the CSE was introduced in 2001, and all these conservative groups, they went against it because it was so elaborate, it was so comprehensive, and they were like, no, let's just streamline into abstinence. Because, okay, I can abstain, but can I abstain from being raped? Am I the one that raped myself? So we have to do things that we have to think outside the box. Okay, it's fine for me, I can abstain, but what if we get to the stage where I don't have power over what is happening to me? What happens then? Is that the end of the case? So that's it.
Alright, so this is where we will wrap the program up today. I just wish that we had more time to talk about this, but we have actually touched about a lot of issues right here, and I'm glad that you actually talked about age appropriate education, sexual education. So just before we go, Simi, just give us a few words, your final words, and all of what we talked about today. What is that important thing that you want our dear listener to take home from this conversation today?
Okay, thank you very much. The reason why I say that in this kind of dialogue is for us to be able to bridge this gap between sexual reproductive health and getting to adolescent and young persons. Now, one thing that I want people, or the things that I want people to also know is that there is no us without us. You cannot innovate ideas, you cannot get us involved, but you cannot do things that favor we young people without us. Then another thing is this is something that involves everybody, community leaders, religious leaders. Let's stop making this like a waging war against religious or morality. Let's try to inculcate this and see how even religion and morality teaches us about sex in a way, but the only thing they teach is abstinence. So there's a way we can actually strike a balance in educating and also get these community leaders involved so that we can all achieve our aim. So this is a discrete call for everybody to take ownership of this so that at the end of the day we can all achieve our aim. Thank you very much.
All right, I mean, less than a minute. Quickly, let's have your final word.
So there's a common saying, Tobashewo, if it were you. So we have to ensure that whenever or whatever is happening around us, it concerns us. We should not dismiss it. Oh, it's not my daughter. Oh, it's not my son. It does not concern me. It's not my family. We have to ensure that there is community collaboration. Everybody, each one teach one, each one raise one. We have to ensure that there is this leveled education, awareness amongst everybody. You've heard about this. You are listening to this radio. The next thing for you is to take it home. Tell people that are not educated, tell people that are not aware about this information that you have gotten today. Pass it to them. Let everybody know what is going on. Because when it comes to you, you will know what to do. So we don't want it to reach your turn now before you take the initiative. So we are urging all of us to ensure that meet our neighbors keepers. Thank you.
Thank you so much, Anu, for that. And I must thank both of you for coming through and thank Hisi too for this important conversation that we have had today. This is Women Radio, and of course, you know that conversations like this does not end here. We have to keep talking about it. For us here at Women Radio, it's something that we keep talking about, over and over again until we see the change that we need. That change, it must come.
Yes.
And we'll definitely keep working towards it. So thank you so much for coming through. And thank you too for tuning in and listening to this special big question that we had to come up with today. We had Anu Oluwapo or Osheni. We also had Simi Loluawe. Thank you so much, both of you.
You're welcome.
My name is Rose Yusuf Kaiser. Do well to keep your dial locked right here on Women Radio WFM 91.7. Good afternoon.